Here we're going to wrap up our discussion of the autonomic nervous system by looking at the anatomy of the sympathetic division. So to begin with right here, we take another look at what the spinal cord cross-section looks like. So of course, this is your gray matter and your white matter. And one of the things that we noticed was that you had posterior and anterior horns of gray matter in all sections of the spinal cord. However, the lateral horns were only present in parts of the spinal cord. This is because the lateral horns themselves contain the preganglionic neurons of the sympathetic nervous system. And they're only going to be present in the gray matter there from T1 to L2. Again, recall that the sympathetic division is known as the thoracolumbar division. Now, as those neurons here leave the lateral horn, they enter the sympathetic chain ganglion. And this allows them to run vertically, right? From the cervical all the way down to the coccygeal levels of the vertebral column, allowing them to target different effector organs across the entire body. And so this is the anatomy of that sympathetic chain ganglion. The idea right over here is that you can see, once again, here's your lateral horn of gray matter. If you assume that those neurons are going to exit through these rootlets, entering the anterior or the ventral root of the spinal cord, and then entering this gray structure right over here, that's what's going to allow them to enter the sympathetic chain. So that's what we call a gray ramus communicans. Right? And so that's it right through there, and there, and there. And then parallel to it is the white ramus communicans. Right there, and there. Right? Sometimes it's the gray communicantes or the right communicantes. And sometimes just called the communicating ramus. So you can pick the terminology that works best for you there. I always like this image because it actually shows you this sympathetic chain in itself running all the way down. Okay, so right there, posterior to the heart, posterior to the aorta that you can see. And so what I want you to know is the route that the fibers can take as they pass down through the sympathetic chain itself. So to begin with right here, your sympathetic preganglionic fibers exit the spinal cord through the anterior root and they enter the white communicating ramus. So here it is right there, preganglionic sympathetic neurons, anterior root, spinal nerve, and here they go through that white communicating ramus right through there. Now, as you can see, there's one of three different routes that those preganglionic fibers can take. Let's look at them in order. So first right here, you can have an immediate synapse with the sympathetic postganglionic fiber. Now, if that happens right there, that postganglionic fiber is going to be stimulated by acetylcholine, and it's going to carry a signal out the gray communicating ramus here, and then out through one of your spinal nerves. The other option is that right over here, that preganglionic neuron can ascend or descend and then synapse with a postganglionic fiber. And so you can see right over here, if you follow one of the preganglionic neurons, it could enter this chain or this trunk, and it could ascend right up here to then synapse on its postganglionic nerve, right? Or it could descend to synapse on its postganglionic nerve. So this, of course, is important because this is what's going to allow a neuron that exits the spinal cord at one level, right, to actually innervate organs eventually that are higher up in the face, right, or in the heart. Whereas it also allows some neurons from that same plexus of the spinal cord to actually run down and to affect effector organs that are further down in the body, like those associated with the digestive and the reproductive system. The third option here has to do with a preganglionic fiber that can then exit the sympathetic trunk without synapsing. And so you can see right over here, this green preganglionic neuron enters the sympathetic trunk, and it then exits through what's called through a different nerve. We're going to look at those in just a second. And it enters a collateral ganglion. And these collateral ganglia are going to be basically distributed throughout the abdominal region of the body. And it contains the synapse between the sympathetic preganglionic and postganglionic fibers that also are going to innervate different organs of the digestive, urinary, and reproductive systems. And so what we refer to these are essentially are those that are associated with individual plexuses. You have a carotid plexus that's going to run to the carotid arteries. And the example that you saw right over here in the lower region of the body was known as a splanchnic nerve, right? And that's what's going to run to those collateral ganglia. But both of those are going to fit the description that you see in option 3 here for one of those preganglionic neurons. When you look at an image like this, you can see a lot of those. So here you can see the abdominal aorta. Here's the diaphragm. And this, of course, lets you know that you're looking at the abdominal region of the body. Here's the two adrenal glands, kidneys. You would see the liver, the pancreas, and the stomach all up in this region. And you'd see the reproductive and the urinary organs down in here. And all along here in yellow, you can see the regions of the nervous system. So running up and down on either side here, you can actually see the sympathetic trunks, right, left and right. And then these little bulges that you see all along here are those ganglia that we're thinking of as collateral ganglia. So they will have different names. You're going to learn some of those later on in the course of time. But this is the inferior mesenteric ganglion, right, superior mesenteric ganglion, celiac ganglia right through there. And it's important to recall that those are all regions where you would see preganglionic and postganglionic fibers innervating, right, that are not a part of this initial sympathetic trunk. Your sympathetic trunks, again, can be seen here on either side of the abdominal aorta or the spinal cord. So there are a few names right over here that I do want you to know. The superior cervical ganglion is going to contribute to those activities of sympathetic nerves associated with the pupils, nasal and salivary glands, and some of the branches to the heart. The middle and the inferior cervical ganglia, closer to the face, again, are going to be innervating structures that are higher up above the thoracic region of the body. Contains organs such as the heart, thyroid glands, and the skin of the face, the chest, and the neck. As you looked at those celiac and superior mesenteric collateral ganglia, those were going to help with innervation to the stomach, the intestines, the liver, the spleen, and the kidneys. And the inferior mesenteric ganglion that we saw was contributing to the urinary bladder, the reproductive organs, and the large intestine. So you don't need to memorize all the organs that are supplied by each of these ganglia. What I would want you to know instead is that the cervical ganglia are those that are higher up, and that these collateral ganglia, right, superior and inferior mesenteric and celiac, are all associated with organs in the abdominal and the pelvic regions of the body. This image does a pretty nice job of showing all of that. Here's your celiac ganglion, superior mesenteric ganglion, inferior mesenteric ganglion, and all the organs that they're innervating. And then up here, you can actually see those individual the cervical ganglia and where they would be carrying these postganglionic fibers. The adrenal medulla, as we'd said, was the middle region of the adrenal gland. It's very important for us in terms of the sympathetic nervous system because it's releasing epinephrine and norepinephrine to have that same effect as your postganglionic sympathetic neurons did earlier. And the difference here is that those neurons were only releasing norepinephrine, whereas the adrenal medulla is releasing mostly epinephrine. Right, so again, you can see it here. The adrenal gland in itself has two layers. The outer region is the cortex, and the inner region is the medulla. So recall here that we're only looking at the medulla as your long-lost postganglionic sympathetic fiber. And the fact that they draw a lot of blood vessels in here is helpful because it helps to illustrate that it is an endocrine organ, depositing epinephrine and norepinephrine directly into the bloodstream. Your parasympathetic division has a different setup for anatomy. Recall that you have the craniosacral division here because you've got regions that come from the midbrain, right, in the brainstem, as well as the lower sacral region of the spinal cord. And we've looked at the anatomy quite a bit already. I think this image is really nice because it shows you the individual ganglia that are associated. I don't have you naming these the same way that I have you naming those that are associated with the sympathetic nervous system, but it does help to see the cranial nerves that are associated with these. And so you can see the oculomotor nerve, the facial nerve, glossopharyngeal nerve, the vagus nerve right over here. All of those are associated with parasympathetic output in the form of these preganglionic parasympathetic neurons. And so I would want you to know these cranial nerves, right, and that they are tied to parasympathetic activity. And the vagus nerve in itself is pretty important for us because if you recall, the vagus nerve has a wide-ranging effect: the heart, the lungs, much of the digestive tract, as well as the urinary system. And so we say that the vagus nerve itself is accounting as 90% of parasympathetic postganglionic fibers in the body. We do say that if you damage both vagus nerves, that's incompatible for life because now you can no longer control breathing rate and heart rate and digestive activity the way that you need to. So apart from these neurons, you do see other control of the autonomic nervous system. The area that we've talked about the most is the hypothalamus. Recall that this was a major control center for the autonomic nervous system, controlling things like heart rate, blood pressure, body temperature, your thirst, your water drive, the endocrine system, which is going to tie into autonomic activity, as we'll see later on, and all these other emotive behaviors that are also associated here with the limbic system. We said that once again, because it was associated with the hypothalamus, your emotions could directly output physiologic activity here. But because you also have the limbic system and the hypothalamus closely aligned with your hippocampus, this can give you your emotive effect to memories in themselves. And so, of course, we see that even though the autonomic nervous system has mainly been associated anatomically for us with the spinal cord, that through the link with the hypothalamus and the cortical regions here for the limbic system and the cerebral cortex here for hippocampus and memories, the brain does still have a pretty large effect in overall autonomic functioning.